They blamed your mood? How many times you heard that? Your mood is contributing to your emotions, to how you're feeling. Well, it was something else. Your sex hormones regulate more than sex. They control your mood, your muscles, motivations, and metabolism. These powerful messengers shape how we feel, think, and function every single day. Sex hormones are chemical messengers that includes estrogen, progesterone, testosterone, DHEA, that's dihydroepiandrosterone. While best known for their roles in reproduction, their influence extends to almost every system in the body, from your brain to your bones. Think of sex hormones like your body's Wi-Fi signal, invisible but absolutely essential. When the signal is strong, everything functions smoothly. When it's weak or glitchy, you notice in your energy, mood, sleep, and even confidence. Estrogen modulates serotonin, dopamine, and GABA, neurotransmitters that affect mood, sleep, and memory. Testosterone enhances assertiveness, confidence, and focus. DHEA has neuroprotective effects, supporting mental clarity and resilience. Low levels may result in anxiety or mood swings, brain fog, poor stress tolerance, depression-like symptoms. Hormonal imbalances often masquerades as a mental health problem. Testosterone and DHEA are critical for muscle protein synthesis in both men and women. Estrogen helps preserve lean muscle mass and protect against inflammation. Muscle loss accelerates sarcopenia, fatigue, and exercise intolerance rises. Physical performance and recovery worsens. These are all when these hormone levels dips down. Muscle is your metabolic currency, and sex hormones found the bank. Testosterone fuels motivation, goal-directed behavior, and confidence. Estrogen affects reward pathways, energy levels, and social bonding. DHEA supports resilience and adaptability under stress. When depleted, you feel like you are coasting in neutral, less ambitious, less engaged, and more withdrawn. Low sex hormones can feel like emotional burnout, even if life looks fine from the outside. Sex hormones directly influence fat distribution, especially belly fat, insulin sensitivity, basic metabolic rate. Imbalances may cause unexplained weight gain, especially abdominal, blood sugar swings, increased risk of metabolic syndrome, diabetes, or cardiovascular disease. If your metabolism feels broken, your hormones may be the missing piece. When sex hormones are optimized, your body responds like it's plugged back in. You feel more alive, more alert, and more aligned. And the best part, balanced hormones don't just help you survive, they help you thrive. So around puberty, sex hormones surge. This kickstarts reproductive capacity and growth. By the late 20s and 30s, levels starts to tapering off. For women, estrogen and progesterone drop sharply during perimenopause and menopause. Men experience a low testosterone decline, often unnoticed until symptoms hit. Women may face different hormone-related conditions at every stage, from PMS in the 20s to PCOS in the 30s to the roller coaster of menopause in the 40s and 50s. Symptoms range from bloating to burnout, and they're often dismissed as normal. But what's common isn't always optimal. PMS, which is menstrual syndrome triggered by the drop in estrogen and progesterone before menstruation, affects up to 75% menstruating women. Common symptoms include irritability, mood swings, bloating, fatigue, breast tenderness. When severe, it may evolve into PMDD, that's premenstrual dysmorphic disorder. PMS isn't just about emotional turbulence, it's a sign that the monthly hormonal symphony is slightly out of tune. PCOS, that's polycystic ovary syndrome. It's a metabolic hormonal disorder affecting 1 in 10 women of reproductive age. And it is characterized by, the PCOS is characterized by excess androgen, insulin resistance, irregular ovulation. Symptoms include acne, unwanted hair growth, such as hirsutism, thinning scalp hair, and fertility challenges, often worsened by blood sugar imbalances and chronic inflammation. PCOS isn't just a period problem, it's a whole body hormone and metabolic issue. Perimenopause starts in the mid-40s and can last 4 to 10 years before the menopause, which is defined as 12 months without a period. Estrogen, progesterone, and testosterone levels fluctuate dramatically. Common symptoms include hot flashes, night sweats, insomnia, memory lapses, low libido, vaginal dryness, mood swings, or depression. Increased risk for osteoporosis, heart disease, and weight gain. Menopause is not the end, but it is a transition, one that requires support, not silence. Every phase of a woman's life comes with hormonal changes, but too often those symptoms are brushed off. They're told just stress or just aging, but let me be clear, hormonal chaos isn't a life sentence, it's a signal that your body wants balance, not dismissal. Testosterone crash in men, that's called andropause. Well, testosterone crashes are real, and they don't just affect sex drive, they show up as belly fat, low motivation, fatigue, and even depression. This gradual shift, often called andropause, is less talked about, but just as impactful. Andropause, also known as late onset hypogonadism, refers to the gradual decline in testosterone levels in men, typically starting in their late 40s to early 50s. Unlike female menopause, this decline is more subtle and can vary greatly among individuals. Some common physical symptoms include increased abdominal fat, decreased muscle mass and strength, fatigue and reduced stamina, erectile dysfunction. Emotional symptoms include low motivation and drive, mood swings and irritability, depression or feelings of sadness. Cognitive symptoms include difficulty concentrating, memory lapses. These symptoms can often be mistaken for normal aging or other health issues, making diagnosis challenging. When to consult your healthcare providers is persistent symptoms affecting quality of life, concerns about sexual health or mood changes. And diagnostic step is you need a detailed medical history and physical examination. Blood tests to measure testosterone levels, typically done in the morning, levels are highest. Additional tests to rule out other conditions, which is important. Not all men with low testosterone levels will exhibit symptoms and vice versa. Therefore, a comprehensive evaluation is essential. So how do you kind of manage and treatment options? Well, lifestyle always comes first. Exercise, Nutrition, a balanced diet rich in essential nutrients supports overall hormonal health. Sleep, 7 to 9 hours. Stress management or stress treatment. Medical treatment includes testosterone replacement therapy, administered by injection, patches, gel, or pellets, aims to restore testosterone level to a normal range. Potential side effects include increased risk of cardiovascular issues and impact on fertility. Regular monitoring by a healthcare provider is crucial. Treatment should be personalized based on individual health status, symptom severity, and personal preferences. So low libido isn't just about a bedroom problem. It's a brain-body disconnect. Estrogen and testosterone influence dopamine, the reward chemical, and oxytocin, the bonding hormone. If your hormones are out of sync, your drive, intimacy, and even your sense of connection can fade. Low libido isn't about desire, it's often about hormonal disconnect. Libido, or sexual desire, is regulated by a dynamic interplay of hormones and neurotransmitters. It involves neurochemicals that affects desire, motivation, and bonding. Hormones that control sexual response and physical readiness. Psychological and relationship factors that influence interpretation of signals. Testosterone in both men and women, primary driver of sexual desire, supports dopamine signaling, key to motivation and reward. Low testosterone equals reduced sexual thoughts, fantasies, or drive. Estrogen, important for vaginal lubrication, arousal, and sensation. Enhances oxytocin production, which is emotional closeness. Helps regulate mood, which is intimately tied to sexual interest. Dopamine, brain's reward chemical, fuels sexual motivation and anticipation. Deficiencies lead to apathy, lack of interest, and reduced pleasure. Oxytocin, known as the bonding hormone, released during touch, intimacy, and orgasm, strengthens emotional connection and desire for closeness. Signs of hormonal disconnect causing low libido. I love my partner, but I feel numb. I don't think about sex. I'm just tired all the time. It's not that I don't want to, I just can't get in the mood. These statements may reflect HPA axis dysregulation, stress hormone imbalance, sex hormone depletion, low testosterone, low estrogen, neurotransmitter deficiencies, dopamine or oxytocin imbalances. Strategies for reconnecting the brain-body circuits. Well, hormone evaluation, test testosterone, estrogen, DHEA, and progesterone. Consider cortisol and thyroid, which also impacts energy and mood. Regular exercise to boost testosterone and dopamine. Protein and fat-rich diet to support hormone production. Sleep restoration, especially deep REM for sex hormone balance. Nutraceuticals and adaptogens. Well, maca roots, tribulus, ashwagandha shown to improve libido in men and women. Omega-3s to improve hormone receptor sensitivity. Communication exercises to strengthen oxytocin response. Non-sexual touch to rebuild trust and emotional closeness. Bioidentical hormone replacement therapy, HRT or TRT, targeted dopamine or oxytocin support when appropriate. Libido is not just about wanting sex. It's a delicate dance between your brain chemistry, emotional state, and hormonal health. When these messengers fall out of sync, the drive for intimacy can vanish. not because you don't care, but because your body isn't getting the right signals. Sex hormones also preserve muscle mass and metabolic rate. When testosterone and DHEA dip, so does muscle, and fat tends to take its place. That means more fatigue, insulin resistance, and slower metabolism. Hormone replacement or balance strategies must be tailored to you. What works for one person can backfire in another. Proper testing, personalized protocol, and ongoing monitoring makes all the difference, because it's not about boosting hormones blindly. It's about restoring balance safely and smartly. Your sex hormones don't just impact reproductive health, they influence how you feel, look, and live. Understanding them isn't a luxury, it's your lifelong leverage point for energy, clarity, and vitality. Thank you.
Please don't forget to like, comment, share, and subscribe.